In this video, we'll discuss about pancreatitis. Pancreas is an extremely important organ located in the stomach. It is an important organ located in stomach. This is commonly known as organ of insulin, where the insulin get produced. So organ of insulin, and there are certain specific disease which can affect pancreas gland. Some diseases will affect pancreas gland. What are these condition? Three important conditions: acute pancreatitis, chronic pancreatitis, and pancreatic cancer. In this video, discuss pancreatitis. Pancreatitis is nothing but inflammation of the pancreatic gland. Inflammation of pancreatic gland, that means swelling of that pancreatic gland. Swelling of pancreatic gland. What can causes the acute pancreatitis is due to sudden insult to the pancreatic gland. Sudden insult to the pancreatic gland, commonly by excess of alcohol intake or gallbladder stone, which are troughing into the bile pipe and touching the pancreas. Sometimes excess amount of lipids, excess triglyceride, excess calcium. All of this can causes inflammation of the pancreas, that is called as acute pancreatitis. Sudden insult to pancreatic organ, excess amount of alcohol intake, gallbladder stone into that bile pipe and touching the pancreas, excess amount of lipid, triglyceride, and calcium. All the things causes acute pancreatitis. What can be done if somebody got acute pancreatitis, or how to we suspect? If you have severe abdominal pain, especially if it is going to the back, you suspect acute pancreatitis. You may become sick sometimes. We ha- uh, we may be vomiting, or we feel very unwell with it. So don't neglect, consult that nearest specialist. So from doctor's point of view, we suspect acute pancreatitis. We do examination and see where the location of the type of pain, and send the blood sample for serum amylase and lipase identification, which is the simple blood test which can give very good information whether the patient has pancreatitis or not. So acute pancreatitis is diagnosed, then next step would be to look for the causes immediately. Any risk factor like alcohol intake or gallbladder, a risk factor like alcohol intake or gallbladder stone or calcium being high, cholesterol being high, if is or these that has to addressed, and most of the time we need a patient to be admitted for treating pancreatitis in the form of keeping giving pancreatic test like NBM, by mouth giving heavy fluids, and sometimes antibiotics. Sometimes give antibiotics, sometimes treating the cause like removal of gallstone, pancreatic stone, and sometimes common bile duct stone by using ERCP procedure. Most of the good things about pancreatitis is most of the patient do well with acute pancreatitis, but some portion of patient would go on to the develop complication like necrotizing pancreatitis, pseudocyst, then sometimes fistulas pancreatic, sometimes respiratory lung involvement, sometimes kidney involvement, sometimes inflammatory response called surgery response, which can be life threatening sometimes. So all these patients need to be monitored closely in intensive care setup, and treating aggressively prevent any complication. Next, chronic pancreatitis would be because of again regular alcohol intake, or sometimes topical pancreatitis, especially in Indian some subcontinent, because of environmental changes, and all the patient can get changes in that pancreatic gland in the form of calcification, that is called as chronic calcified pancreatitis. Some people get abnormal gene can leads to genetic hereditary pancreatitis. In addition to this, patient can get sometimes without any reason chronic pancreatitis. How to be identified? If somebody is having long standing abdominal pain that is radiating to the back, we suspect chronic pancreatitis and elevate approximately. What sort of test can be done? Simple test like ultrasound abdomen and CD scan tell us the patient has got chronic pancreatitis or not. Then go on to investigate in the form of looking at the risk factors like lifestyle risk factor, genetic testing, all they needed to be worked out. Once diagnosed that chronic pancreatitis, the treatment would be supportive treatment, mainly in the form of pain relief. Pain relief. Somebody may be having pancreatic duct stone. They can be removed by ERCP by doing endoscopic. ERCP endoscopic method of removal of pancreatic stone if they are very small, or if the stone are large. The patient can be suspected to the procedure. Name is called ESWL kind of. It is a kind of laser treatment. This laser treatment pulverizes pulverizes the stone, and then after that patient would record ERCP. Sometimes patient may require surgery, and by suturing the duct, pancreatic duct with small intestine, we have reduced the pressure in the pancreatic duct, thereby giving some symptomatic relief. Nowadays, we do a procedure called ESU guide, celiac blockage or neurolysis for cancer patient to give symptomatic relief of pain. Whether we inject around pancreatic nerve supply by doing endoscopic ultrasound. Endoscopic ultrasound is a methodology where a scanner is attached to that endoscope. The scope is going inside. Look at that pancreas closely, where we can inject around the pancreas.